Guru Nation, welcome to SOS. Thank you so much, Morale, by the way. This is very nice of you to come join us. Pulmonologist, expert in this field, very niche, but you do it very well. And we had a conversation years ago on the Guru
Absolutely.
Nation. You even gave me book recommendations and things like that.
Got that. Yeah.
This is an appetizer. My mid-level provider, nurse practitioner, he had to leave. And he was like, you have to get Morale. I was like, oh, yeah, I've interviewed him before. And he said, no, but we have to go deep into like the clinical.
Absolutely.
So we're going to do this appetizer for that because we actually have never done a deep dive into really any clinical condition. So we're going to do a little bit when on Zoom when you have time. And I'll get Jaime on there because he was loving it. But just reintroduce yourself. There's a lot of new audience. And first of all, why did you come here other than to support? I appreciate it. But do you find some value from this?
Yeah. First off, Dan, thanks a lot for having me on this podcast. And credit to you. To be honest, when I started in clinical trials, I did my first trial was in pulmonary fibrosis. But when I actually wanted to know more about being a clinical trialist, I actually got into YouTube and I came across you. And so I learned everything about clinical trials from you.
Oh, man.
So
Thank
Guru
you.
Nation, yeah. So I mean it very sincerely. And
I know, you're one of the old school.
Yeah, so the start in clinical trials, I would say, you played a huge role in that. Okay, so one of the main reasons I wanted to come here was to be able to meet you formally, even though we've now texted each other,
because on Zoom
emailed
is not
each
the
other.
same, you know.
And I said, okay, you know what, this is your conference along with Brad, but I wanted to take this opportunity to meet you.
Thank you.
Okay,
I'm glad we got a chance to do it, man.
Thank you. Yeah, so
we could sneak them in between all the podcasts.
Yeah.
It's been a tornado, no pun intended, of podcasts.
Yeah, so kindred spirit, and I really appreciate what you've done for the clinical trials community across the nation. And anybody new starting, I actually refer them a lot to your videos. Okay, about learning. So yeah, you've had a huge impact,
That's
whether
awesome.
you realize
Thank
it or
you.
not.
Thank you.
Yeah, thank you. So that's why I'm here at SOS. But I'm a physician by trade. I'm a pulmonologist. My special interest is in pulmonary fibrosis.
That's where we're gonna go deep dive.
Yes. So
deep dive.
And when I got into pulmonary fibrosis when I started training at the University of Iowa 20 years ago. The division chief had a clinical interest there. I was doing something else, but when I went into practice 17 years ago, I felt the pulmonary fibrosis space was wide open. There was no treatment. Nobody was paying attention to it. And I felt there was an opportunity there. And it sort of fit in with my training as well because I was trained in it. So from then on, it's been off to the races. So I'm in the Pulmonary Fibrosis Foundation Steering Committee. I'm directing the subgroup for clinical trials.
Okay.
I have
That's
a strong,
amazing.
long commitment.
And you've been doing this for a while.
Correct.
What's the secret, though? Because doctors, a lot of them, you hear it one and done.
Yeah, so no, for me, it's all about paying attention to the people who have forgotten. So pulmonary fibrosis is a set of patients who have forgotten, ignored, and not paid attention to, and that's how I started. It comes from that caring heart, and then I felt they needed a champion. The patients gave me that feedback, so that's sort of how I started, becoming passionate about that disease. In terms of clinical trials, for the disease, I think it's a sort of a virtuous cycle. If you want to be successful, you got to have a clinician who's interested and passionate in the disease. And also being rare disease, you got to work with the support groups.
And it's not like a necessarily a lot of site owners, not necessarily doctors, but site owners in general. A lot of them have this delusion that it's fast money, and it's actually the complete opposite. It's very slow money initially. Not that it's not a good business.
You're talking about fibrosis or clinical trials?
No, just clinical trials in general.
Yeah, correct.
It's very slow, but if you do it consistently, it's very good.
Correct.
Right?
Correct,
but a lot of people don't wait that long.
Correct.
And it relates to what you said, because when you marry a niche and a underserved, basically, condition.
Absolutely.
It gives you a higher purpose than just the business.
Correct. Yeah, the business is the secondary piece. the primary piece is to make a change in the lives of people.
And that's the thesis that you want, whether it's a doctor like yourself who hyper specialize. We had another site owner here. She was very concerned with underserved patients, and like she does not accept studies with small stipends for the patients. She turns them down.
Absolutely.
And she even said it's about doing the good first, the business model follow, but that's
Absolutely.
the leading thesis. And
I agree.
your similarity in the sense of the therapeutic condition.
Yeah, absolutely.
That's
Yeah.
what's important, man. And I
agree.
think, do you think as these site networks get bigger, like we lose some of that artisan touch?
I don't know. I don't know, to be honest. And
I don't either.
it's interesting that the site networks. Obviously, there's going to be, with private equity coming in, there's going to be a definite demand for efficiency and margins, and whether they will achieve it or not is not known. What we have seen is that, at least in the community where I work and live, private equity stepped into a radiology practice, and the practice has been decimated. Radiologists have left. X-rays and CT scans are not read for many weeks. Patients are suffering. So
the service got worse after
Correct. So
unfortunate.
So what is on the book about the impact of efficiency that a private equity can drive is not translated at the bedside.
That's unfortunate. And you're seeing this across the country.
I read about it across the country, but I've seen it in this one example in Greensboro.
Me as well in Yuma. It's a very big theme of
Really?
underserved communities with large private equity backed hospital systems buying all the practices. Now, some of the services are good, but they do have like a monopoly control, pricing pressure on the independent provider. So, and luckily for me, they stopped doing research, so they don't do it anymore. The private equity came in and actually cut the research out.
Interesting.
They were only doing cancer anyways and emergency medicine, but
Correct.
It's always
So that's another misconception, that when you mention clinical trials, they only think cancer because of that NCI designation.
Yeah.
But it really shouldn't matter only for cancer.
Right.
All diseases need to be studied.
Yep.
Yeah.
We need to go deep dive. So just
Absolutely.
Pulmonix.
Yeah.
Morale, I've been following him 10 years.
Yes, 10
On
years.
LinkedIn?
Yeah, 10 years since we started PulmonIx. And, before that, I was a clinical trialist with my mentor, but the business infrastructure was not formed.
Yeah.
So I had to, when he retired, I had to learn a lot in order to quickly adapt into the business. And your YouTube's made a big difference.
Thank you. I can't wait to go deep dive. We got to do it soon.
Yes, today.
Jaime's in the plane
Oh,
right
yeah,
now.
that's right. Oh, yeah.
He really wants to learn this stuff, and because he's our sub.
Yeah, absolutely. I'd be happy to collaborate and converse.
Thank you.
Not an issue at all.
And I'll introduce you to my PI. He's a nice dude in Yuma over there, and he does have some patients at IPF. So,
Okay.
Thank you very
I'll
much.
be happy to connect with him too, to help you with your IPF studies.
Of course.
Okay.
And stay tuned. Follow his LinkedIn right now, Morale, and stay tuned for the full deep dive. First time we ever did it on this channel. Deep dive onto the clinical nuances of your specialty.
Yeah.
Maybe that's a new feature for the
Yes.
channel.
We'll be totally excited.
I'll get a psychiatrist after. I'll get a derma. This can go on forever, man. Okay, subscribe, comment, share, and thank you very much for your
Thanks,
support
guys.
at SOS. Bye-bye. Hey, if you guys like that kind of content, make sure you subscribe, comment, share. Stay tuned for more videos.